9 warning signs of stroke. 1 month before it happens, shocking symptoms revealed. Strokes are often referred to as silent killers because they strike suddenly, sometimes without any obvious warning, and can leave a person with lifelong disabilities, or worse, lead to death. What makes strokes particularly terrifying is that they're not just a risk for the elderly or those with a known medical condition. They can happen to anyone at any time. In fact, strokes claim more lives each year than some of the deadliest diseases and accidents combined. According to the World Health Organization, WHO, stroke is the second leading cause of death globally, accounting for approximately 11% of all deaths. That's more than the number of fatalities caused by road accidents, lung cancer, or diabetes. In the United States alone, someone has a stroke every 40 seconds, and every 3.5 minutes, someone dies from a stroke. These numbers are staggering, and they highlight just how crucial it is to recognize the early warning signs of a stroke. The real danger lies in the fact that strokes often go unnoticed until it's too late. The symptoms can be subtle, developing gradually over time, and are frequently mistaken for minor health issues or just part of aging. But ignoring these early signs can be deadly. Studies show that the chances of survival and recovery significantly increase if a stroke is identified and treated within the first few hours. This makes early detection absolutely vital. In today's video, we're going to delve into 9 warning signs that could indicate a stroke is on the horizon, sometimes even as early as a month before the actual event. These symptoms may seem unrelated or insignificant on their own, but they're often the body's way of sending out distress signals that something is seriously wrong. We'll explore each of these signs in detail, supported by scientific research from leading medical institutions, so you can be better informed and prepared. Understanding these warning signs could be the difference between life and death. So, whether you're at risk, have loved ones who could be, or simply want to arm yourself with this vital knowledge, stay with us as we uncover these shocking symptoms. By the end of this video, you'll be equipped with the information you need to act swiftly and potentially prevent a life-altering stroke from happening. Before we get started, make sure to subscribe to our channel so you don't miss out on more tips for living your healthiest life. Number 1. Persistent high blood pressure. Persistent high blood pressure, also known as hypertension, doesn't present noticeable symptoms until significant damage has already been done to the body. But what many people don't realize is just how closely linked high blood pressure is to the risk of having a stroke. In fact, hypertension is the single most important risk factor for stroke, responsible for about half of all stroke-related cases globally. When blood pressure is consistently high, it means that the force of blood against the walls of your arteries is too strong. Over time, this high pressure causes damage to the arteries, making them harder and narrower, which is a condition known as atherosclerosis. This damage is particularly dangerous in the arteries leading to the brain. If a blood clot forms in these narrowed arteries, it can block the flow of blood to the brain, leading to an ischemic stroke, the most common type of stroke, accounting for about 87% of all cases. But that's not the only danger. High blood pressure can also lead to hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, causing bleeding in or around the brain. This type of stroke, although less common, is more deadly and can result in severe brain damage or death. What makes persistent high blood pressure so dangerous is that many people are unaware they even have it. It's often called a silent condition, because it doesn't usually cause symptoms until it has already done significant harm. This is why regular monitoring of blood pressure is crucial, especially as you age, or if you have other risk factors like obesity, diabetes, or a family history of hypertension. Scientific studies have repeatedly shown the strong correlation between hypertension and stroke. Research published by the American Heart Association highlights that individuals with high blood pressure are up to 4 times more likely to suffer a stroke compared to those with normal blood pressure levels. Furthermore, lowering high blood pressure is one of the most effective ways to reduce the risk of stroke. Even a small reduction in blood pressure can significantly decrease the chances of having a stroke. Number 2. Excessive fatigue. Excessive fatigue is often brushed off as just a byproduct of a busy lifestyle, stress, or lack of sleep. However, When fatigue becomes persistent and overwhelming, it can be a sign of something far more serious, including the potential onset of a stroke. Fatigue in this context isn't just feeling a bit tired after a long day, it's a profound sense of exhaustion that doesn't improve with rest and can interfere with daily activities. Fatigue as a warning sign of stroke is particularly concerning because it is subtle and can be easily dismissed. However, it's important to understand why the body might be feeling this way in the lead-up to a stroke. The brain requires a constant and reliable supply of oxygen-rich blood to function properly. When there is a problem with blood flow, such as narrowing or blockages in the arteries, the brain doesn't get the oxygen it needs. This lack of oxygen can result in a decrease in cognitive and physical energy, leading to feelings of extreme fatigue. Studies have shown that excessive fatigue may precede a stroke by days, weeks, or even a month. One such study published in the journal Stroke found that individuals who reported extreme fatigue were more likely to suffer from ischemic strokes, where blood flow to the brain is obstructed. This form of stroke is the most common, and fatigue is a key early warning sign because it suggests that the brain is struggling to cope with reduced blood supply. Number 3. Vision problems. Vision problems, particularly sudden or unexplained changes in eyesight, can be one of the earliest and most telling signs that a stroke may be imminent. The eyes are often described as the windows to the soul, but they are also windows into our brain health. Any disturbance in vision could indicate that the brain is not receiving adequate blood flow, which is crucial for maintaining the function of the optic nerves and visual processing centers in the brain. The brain's visual centers, located in the occipital lobe, are highly sensitive to disruptions in blood flow. When these areas do not receive enough oxygenated blood due to a blockage or narrowing of arteries, it can lead to a variety of visual disturbances. These problems can manifest as blurry vision, double vision, diplopia, partial loss of vision, like tunnel vision, or even sudden temporary blindness in one eye, a condition known as amaurosis fugax. Types of vision problems as stroke warnings: blurry vision, double vision, partial vision loss, sudden blindness in one eye, amaurosis fugax. Studies published in journals like The Lancet and Neurology highlight that individuals who experience sudden visual disturbances are at a significantly higher risk of experiencing a stroke within the next few days or weeks. For example, a study conducted by the American Heart Association found that about 1/3 of people who experience a TIA, which often includes vision problems, will have a more severe stroke within a year if left untreated. Number 4. Sudden severe headache. A sudden severe headache can be one of the most alarming and immediate warning signs of a stroke, particularly when it strikes out of the blue, and with an intensity that is often described as the worst headache of your life. This type of headache is not your average tension headache or migraine. It is often a sign that something more serious is happening inside the brain, specifically that a blood vessel may have ruptured or is being blocked, leading to a stroke. Sudden severe headaches associated with strokes are typically linked to two main types of strokes: hemorrhagic strokes and ischemic strokes. Hemorrhagic stroke, which occurs when a blood vessel in the brain bursts, causing bleeding in or around the brain. The sudden increase in pressure from the leaked blood can lead to a dramatic and intense headache. This is the type of headache that often catches people off guard due to its severity and sudden onset. Ischemic stroke. This more common type of stroke occurs when a blood clot blocks a blood vessel leading to the brain, cutting off the brain's oxygen supply. While ischemic strokes are less likely to cause the kind of explosive headache seen in hemorrhagic strokes, they can still cause a severe headache, particularly if the blockage occurs in a vessel that leads to a large portion of the brain. A study published in the journal Stroke highlights that nearly 1/3 of individuals who suffer from a hemorrhagic stroke report experiencing a sudden, severe headache just before or during the onset of other stroke symptoms. Number 5. Numbness and weakness in body extremities. Numbness and weakness in the body, particularly in the extremities like the arms, legs, or face, is one of the most classic and recognizable warning signs of a stroke. This symptom often appears suddenly and is typically concentrated on one side of the body, indicating that the brain's control over that part has been compromised. Understanding this symptom's significance and responding to it promptly can be critical in preventing the most devastating outcomes of a stroke. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. Within minutes, brain cells begin to die. The specific symptoms of a stroke depend on which part of the brain is affected. If the stroke occurs in the area of the brain responsible for controlling muscle movements and sensory information, it can result in sudden numbness, weakness, or paralysis in the corresponding part of the body. A study published in The Lancet emphasized that these symptoms are among the most common presentations of stroke, particularly ischemic strokes. The study found that more than 80% of stroke patients experienced some degree of hemiparesis, weakness on one side of the body, or hemiplegia, paralysis on one side of the body, as their initial symptom. Number 6. Speech problems. Speech problems, particularly those that arise suddenly, are one of the most alarming and immediate warning signs of a stroke. Difficulty speaking, understanding speech, or finding the right words can be both frightening and confusing, not just for the person experiencing these issues, but also for those around them. These speech problems, known medically as aphasia or dysarthria, occur when the areas of the brain responsible for language are compromised, typically due to a lack of blood flow caused by a stroke. According to research published in the New England Journal of Medicine, language disturbances are among the most common initial symptoms of stroke, especially in cases where the stroke affects the left hemisphere of the brain. The study also found that speech problems are often accompanied by other symptoms like facial drooping or arm weakness, but they can also occur in isolation. Sudden speech difficulties are not just a minor inconvenience, they are a red flag indicating that the brain is in distress. The importance of immediate medical attention cannot be overstated. Speech problems often signify that a stroke is either in progress or imminent, and delaying treatment can lead to severe and permanent damage. Number 7. Hallucinations. Hallucinations are a less common but particularly troubling symptom that can occur before or during a stroke. They involve seeing, hearing, smelling, or feeling things that are not present in reality. When hallucinations appear suddenly, especially in someone with no prior history of psychiatric conditions, they can be a significant red flag that something is seriously wrong in the brain. In the context of a stroke, hallucinations typically result from disruptions in the brain's normal functioning due to a lack of blood flow, and they should never be dismissed. Research published in the Journal of Neurology highlights cases where patients experienced visual and auditory hallucinations immediately preceding or during a stroke. These hallucinations were found to correlate with specific areas of brain damage, underscoring the connection between disrupted blood flow and sensory misperceptions. Number 8. Neurological problems. Neurological problems are critical warning signs of a stroke and encompass a wide range of symptoms that affect brain function. These issues can manifest as sudden changes in mental status, coordination, or consciousness, and are often indicative of a disruption in the brain's normal activity due to a stroke. Identifying these problems promptly is essential, as they can signify the need for immediate medical intervention to prevent further brain damage and improve outcomes. The specific neurological problems experienced during a stroke depend on the location and extent of the brain damage. These problems can involve cognitive functions, motor skills, and overall brain coordination. According to a study published in Stroke Journal, cognitive impairment and altered consciousness are common in stroke patients, particularly in those who experience large vessel occlusion strokes. The study highlights that sudden changes in mental status are often among the earliest signs of stroke and should prompt immediate medical evaluation. Number 9. Loss of coordination. Loss of coordination, also known as ataxia, is a significant warning sign of a stroke that can manifest as difficulty with balance, unsteady movements, and impaired fine motor skills. This symptom indicates that the brain's ability to coordinate muscle movements is compromised, which can severely impact a person's ability to perform everyday tasks and maintain their balance. Recognizing and addressing loss of coordination promptly can be critical in minimizing the impact of a stroke and ensuring timely treatment. A study published in Neurology examined patients who experienced ataxia as a result of stroke and found that the symptom was linked to damage in the cerebellum or brainstem. The study highlighted that coordination problems were a significant predictor of stroke severity and functional impairment. Recognizing the warning signs of a stroke is crucial for prompt intervention and reducing the risk of severe outcomes. Each symptom serves as a critical indicator that something is seriously amiss in the brain's functioning. Time is a critical factor in stroke management. The sooner a stroke is recognized and treated, the better the chances of minimizing brain damage and improving recovery outcomes. Prompt medical attention can significantly impact the effectiveness of treatment. If you or someone you know experiences any of these warning signs, do not hesitate to seek emergency medical care. Recognizing these symptoms early and getting prompt treatment can make a profound difference in outcomes. Remember, strokes are medical emergencies, and every second counts. To stay updated with valuable health information and tips for recognizing and managing stroke symptoms, be sure to subscribe to our channel. Your health and the health of your loved ones are incredibly important. Stay informed, stay proactive, and let us help you stay ahead in your health journey. Thanks for watching, and see you in the next video.